One side of the face suddenly droops. An arm becomes weak. Speech turns slurred. In a stroke, minutes matter because brain cells begin to die fast. The earlier you recognize the warning signs, the better the chance of protecting the brain and preventing lifelong disability. Welcome to the Nurse Scrub Club, where we make complex nursing topics simple, visual, and memorable. I'm your nurse educator, RN Karimi. Today, we're breaking down stroke, one of the most time-sensitive emergencies in healthcare. We'll cover what a stroke is, how to recognize it using FAST, and the nursing priorities that can help save brain function. A stroke happens when blood flow to part of the brain is interrupted or when a blood vessel in the brain ruptures. Either way, brain tissue is suddenly deprived of oxygen. Without oxygen, brain cells begin to die. There are two main types of stroke. The first is an ischemic stroke, caused by a blockage. The second is hemorrhagic, caused by bleeding. Ischemic strokes are more common, while hemorrhagic strokes can be especially dangerous because the bleeding increases pressure inside the skull. The brain controls movement, speech, vision, balance, sensation, and behavior. So the symptoms of a stroke depend on which part of the brain is affected. If the speech area is affected, the patient may suddenly have trouble talking. If the movement area is affected, the patient may suddenly become weak on one side. One of the easiest and most important ways to recognize a stroke is the acronym FAST. That sudden facial asymmetry can be a major warning sign. A is for arm weakness. Ask the person to raise both arms. Does one arm drift down? Does one feel numb or weak? A sudden one-sided weakness should always raise concern. S is for speech difficulty. Is the speech slurred? Are the wrong words coming out? Are they suddenly unable to answer clearly? Changes in speech are one of the most recognizable stroke signs. T is for time to act. If any fast sign is present, even if it improves, it is time to call emergency services immediately. Do not wait. Do not let the person sleep it off. Stroke treatment depends on speed. Fast is powerful, but stroke can also present with other symptoms. Watch for sudden confusion or vision changes. Watch for dizziness, trouble walking, loss of balance, numbness, or a sudden severe headache with no known cause. When stroke is suspected, the first nursing priority is rapid recognition and immediate escalation. Follow your facility's stroke protocol right away. This is not a wait-and-see situation. That single detail can affect treatment decisions and timing. Ask the family exactly when symptoms started. Next, think ABCs: airway, breathing, and circulation. Assess respiratory effort, oxygenation, and overall stability. Perform a focused neuro assessment. Check level of consciousness, pupils, facial symmetry, and speech. Check strength, sensation, and ability to follow commands. Compare both sides of the body carefully. Check the blood glucose right away. Hypoglycemia can mimic stroke symptoms, and you never want to miss a treatable cause. Keep the patient NPO until a swallow screen is completed. Stroke can affect swallowing and increase aspiration risk. Establish IV access and prepare the patient for urgent imaging, usually a non-contrast CT scan to check for blockage or bleeding. Practical watch points include frequent neuro checks, blood pressure monitoring, and fall prevention. Safety is key. Watch for worsening mental status. A patient who becomes more sleepy or harder to arouse may be getting worse. Immediate escalation is needed for one-sided paralysis, slurred speech, seizures, or unequal pupils. This is the danger zone. Recall our 72-year-old patient. He showed face drooping and arm drift. He was FAST positive and help was called immediately. Our second patient had confusion and vision changes. These look different, but they are still highly concerning for stroke. Patient and family teaching matters too. Teach families to remember FAST. Stroke symptoms can be sudden and painless. Reinforce prevention. Control blood pressure, manage diabetes, stop smoking, and follow up with providers. Here's the big takeaway. Stroke is a brain emergency. FAST helps you recognize it. Face drooping, arm weakness, speech difficulty, time to act. For nurses, priorities include last known well, ABCs, neurochecks, glucose check, and rapid CT preparation. Recognition saves brain function. Thanks for joining us at the Nurse Scrub Club. Stay sharp, stay curious. Check your knowledge with our stroke quiz, and don't forget to like, share, and subscribe. We'll see you in the next one. Bye for now.